you know, your client comes in with whiplash, jaw pain, headaches, you've tried everything, or you're getting bored and they're not getting helped, this is a great way to work. So the conditions that we can treat in this position is generalized neck pain, any kind of whiplash, any kind of jaw stuff, frozen shoulder. This is a great way to work frozen shoulder. Okay, let's do sideline stuff. Nobody ever does this and it's so necessary. So there's a couple of ways that we can do this. So if you're doing neck pain, whiplash, headache, you don't really have to worry about the draping in the lower body. So let's start with that. We'll do, you know, your client comes in with whiplash, jaw pain, headaches, you've tried everything, or you're getting bored and they're not getting helped. This is a great way to work. I just worked on a pregnant lady today and had to put her in sideline. And so I think a lot of us think that there's nothing we can do in sideline, or it gets super boring and I don't know what to do. So this is what this video is about. And we'll go from there. So you want to give your client a comfy pillow. And you're going to go ahead and lift up. Is that where it needs to be? Is that too high?
I think it's okay.
Okay. And then you have them turn whatever injured side there is. And you're going to say, just go ahead and bring your top leg up and over, and then straighten your bottom leg. And you really, if you're dealing with hip pain, you're going to try to get this up higher. So because we're not doing that right now, I'll leave it here. And then you just want to make sure that they're comfortable. If they're in pain, just have them. A lot of times when I have disabled people, let me go ahead and take your arm. I'll say, how do you sleep, right? How do you sleep? And then I get them in the position that they sleep. And most people sleep on their side. So the conditions that we can treat in this position is generalized neck pain, any kind of whiplash, any kind of jaw stuff, frozen shoulder. This is a great way to work frozen shoulder. So when I treat injury, I hardly ever use oil because it's very hard to access the fascia that way. So the second you put oil on your client, connective tissue is really limited, connective tissue work. And so I start in areas where everybody's in pain. Now, one of the things that I've learned over the years, doing this 20 years, is that I'm not going to do anything that hurts my body. It's not that I don't care if it doesn't feel good. Of course it needs to feel good, but it's not worth it. Most of us don't make enough money to injure ourselves. And the amount of money we spend fixing ourselves when we're injured is not worth it. So if you notice here, this is where the transverse processes are, okay? This is where the spinous processes are. Transverse processes, spinous processes. One of the greatest mistakes that newer therapists make is they kind of rake over people's transverse processes and they say, oh, you've got some adhesions. But those aren't adhesions. They're very, very pointy here. So you want to be just behind them. Now we're talking like a finger width, and I'm just moving the skin to get back there. I'm not way over here because that's going to be a strange angle for my hand and it's not going to feel good. So I'm going to be, here's the transverse processes. I'm going to be right behind them. Now let's do a little anatomy review, okay? You've got 4 suboccipitals right here. 1, 2, 3, 4. All right here, finger width apart. You've got splenius capitis, you've got splenius cervicis, you've got the SCM attachment a little bit more anterior. You've got the insertions of your scalene muscles, C1 to C4. You've got levator scapula that also inserts on the transverse processes. So you're literally accessing about 8 different muscles in like an inch and a half worth of space. So what's great for us as practitioners is that means we don't have to work hard. So look at my knee placement right now. This allows me to keep my spine straight. And I'm just using my arm like a lever. See? My fingers are really doing the pressure, but I'm not doing this because that doesn't feel good. So I'm just falling with my chest. See how I'm going from here to here, from here to there, from here to there. Thank you for watching. You stayed to the end. What else do you want to see? Please comment below. Really helps the channel. My tiny little baby bodywork channel, yeah.